body has an ability to heal. If you cut yourself, you will heal.
Holistic is body, mind and spirit. That's what holism is. And what we try to do in a holistic form is to treat the body, mind and spirit.
Your body knows how to heal itself.
That's what holistic is. All holistic treatments are really promoting you to heal yourself. Just tapping into that. Everybody has the ability to heal themselves.
If there's anything out there that's of help and of benefit to the patients, certainly we should probably be using it a lot more.
I said I wouldn't mind doing that. So she paid for the course for me if I treat her. So that's how I got into it. From then it just went on to the massage, the physical therapist. And once you get on this ball game, you just want to do course after course.
As I was doing massage, somebody noticed that my hands were very warm, and I realised that there was energy coming through my hands. So I looked into finding out more about energy and attuned to Reiki, which was my first step. And as soon as I became aware of our energetic beings, it led me further down that road, and I came across homeopathy quite by chance, looked into it and discovered that it was a very effective way of treating not just physical ailments, but mental and emotional ailments in a very gentle manner. So I enrolled in the college, studied for 4 years, and graduated back in 2007. And I've been practicing ever since. But what I liked most about it was its gentle interaction with the body.
Kinesiology is a complementary therapy, and it's based on Chinese acupressure theory, and one of its main principles is, as I use it, is that the body knows how to heal itself. So a very simple muscle test is used as a kind of a diagnostic test to see where we should work and where there might be imbalances in the body. So the idea is that you're working to bring balance as best you can to the person's body for kind of where they're at the time. And the idea is, because you're working with the body, because the body is kind of saying to the practitioner, this is what I want and this is the order I want it in. It's not the practitioner telling the client what they need. So it's always the person's body is providing the feedback the whole time. And so you work based on priority, based on what the client's priority is. So you could have two people with exactly the same symptoms, but very different reasons for having them. So the first person, if you had two people come in with digestive problems, the first person could say need to stop eating wheat. The second person could be under a massive amount of stress, and that's the reason they're having digestive problems. But how you find that out is you test a single muscle in the arm, as it's a nervous system response, and you're kind of saying, where should I work? Should I be working with nutrition? Should I be working with stress? Should I be working with physical pain? And every time you answer a question, you're usually going to introduce another question. So the idea is that you're peeling back layers of the person, but you're doing it at a rate that their body is able to handle.
Reflexology works on the feet, and what that does is we would manipulate your feet and massage them in certain particular ways. And on your feet, the whole body is mapped out in miniature. So when we're working on your feet, we're working on particular organs of the body to help to rebalance.
We would be more trained as GPs in the conventional medical therapies, but we're now finding that there's a lot and an increased range of holistic therapies. We would tend not to have learned much about them as undergraduates, or even in our postgraduate, after university experience. We do refer people though, and a lot of GPs would have a fairly positive opinion about holistic medicine in the right setting. And the few provisos we would have is that people would have, say, if they have a problem with their lower back, or they have a problem with joints, or they feel they need holistic medicine, that it may well be best to get it checked medically first, and to make sure that there's no serious problem that needs medical therapy, because we would find that holistic therapies are very good as an add-on therapy for us. We tend not to refer specifically for holistic medicine, but in my own situation I would have referred patients to get certain types of massage or yoga. I would often refer people with back pain to go and get a Pilates course, because that has now shown that it builds up the strength of the muscle in the back. And also for certain types of pain, I have referred people or clients on to get a course of acupuncture.
About the last 2 or 3 months, it's been really, really sore, and this is the time when I really need to be in full physical fitness, because we're doing our project out in the smoker's yard, and I just can't do what I'd really love to be able to do, like hike and stuff around, and because I know I'm physically able to do it, but this is just holding me back.
You again would sit down and you would do your consultation with them, and you would decide with them what would be the best form. You may start off with doing 10 or 15 minutes of a back massage if they'd allow you, because you've got so many nerve endings and so many muscles in the back and the spine area that just doing a gentle relaxation massage on these areas can relax the person.
I sort of look at the whole person, would they need a physical therapy, which is mostly what we do here as physical therapists. We would be working on different parts of the body to help them.
Absolutely, homeopathy can be very helpful for very physical ailments. I've treated quite a few extreme headaches or period cramps or backaches. And it also treats the long-term issues behind injuries. If it's a specific injury, yes, it can help, but also for chronic or recurring injuries, where it's a time of year, let's say into the winter time, where swellings happen in the knees or arthritic pains begin. Homeopathy can help to sort of balance the body again.
I went to the doctor last week, and because it was so bad, and she put me on B.I.F.E. So I'm on 2 B.I.F.E. tablets a day, one in the morning and one in the evening, and it still wakes me up at night, the pain.
I use a technique called quantum touch. It's an energy therapy, and it's based on quantum physics. And the idea is that the practitioner brings a really high vibration to the client's body, and then the client's body will try and meet that vibration to heal. So it's kind of stimulating the individual's own personal healing mechanism. And very often when you're working with people who've got physical pain, they'll start feeling, say if you're working on a hip, they'll start feeling nerve tingling down the leg, or they'll get heat in the point that you're working on, or cold. Sometimes people feel extreme cold in the area that you're working on. So it's usually energy treatment that I use if I'm dealing with a physical structural problem. Now, having said that, other kinesiologists will use slightly different techniques. I can also test individual muscles to see if there are ones that are particularly weak or over strong. If you have one muscle that's too strong, then another muscle will underfunction against it, and you'll end up with a weakness and probably pain later. So you would test to see where the weakness or imbalance is, and then you'd muscle test to find out how to address it, how to balance it.
Say for the lower back, they should be advised to get up and try and not sit in a chair all day, but to get out and walk a little bit. People with chronic backs in the past used to be told to lie in bed for 10 days, but now really the main feature is to try and get them up and moving, because it's been shown that if you stimulate the muscles and stimulate the blood flow, that you'll heal the muscle much quicker. And this all goes into the sports medicine now, where people who have sports injuries, they get them up and get them out and get them working at the sports injury much quicker than they would have in the past. A broken bone is a different thing. You've got to wait until the bone has mended and has united, but after that, intensive physiotherapy has been shown to build up the muscle again and to get things moving. For somebody who's in a very vigorous job, again, if they've got a problem with a particular joint, it's going to need, we would advise physiotherapy to build up the strength of the muscles in the joint, and just to try and keep them as active as possible. But some problems that can happen are that if somebody has chronic pain, it can lead on into being low, being down, being depressed, and you get into a cycle like that. And it's very important to try and tie those two together, where you might need something for the chronic pain and you might need something for their mood as well. That's important.
Right, but I saw a doctor that is not familiar with me, or that I wasn't familiar with, and she kind of panicked when I told her that it was here, because she thought it was my heart, and she sent me for an ECG, which it came back perfectly normal, thank God. And so, you know, that was it. You know, she couldn't find anything wrong. But I mean, how can you find pain? You know, it's hard to, you know. But my own doctor knew exactly where to put her thumbs when I went to her, and she said, you know, is it here, does it go here, down here, you know, and it does really stop at my elbow, but like earlier on I was showing you, my hand is absolutely freezing, so it's obviously blocking some sort of vein or something, so it's really bad.
You're not going to bring them upstairs and do a deep tissue massage on them, you know, because they'd end up roaring, crying or something, which has happened to me before, because it's all there, it's all stuck there. Once you start loosening the muscles up, they can start crying, everything can start it's too aggressive.
Depending on the treatment, you might be able to say to them to come in maybe on Monday and a Saturday. You could do, you know, if they really needed it. But mostly it's once a week for 4 to 6 weeks. And then after, it would be once a month just for upkeep.
As my previous point was, that they can be given a lot of time, and that can tease out a lot of maybe underlying stress that they may feel. Then they can come back and realise that perhaps their chronic pain could be as a result of a stress problem that we can then deal with.
Well, homeopathy is holistic by nature, so it treats the body as a whole, not just in parts. So we can treat ailments such as anxiety, worries, fears. We can treat physical ailments, as simple as a headache, right through to more chronic conditions like hay fever or asthma. But homeopathy is treating the person and not the ailment. So I would never say that I treat an asthma or I treat hay fever. I would treat a person who happens to have asthma. It treats the person who has the ailment.
I'll actually put the supplement on their body, and the idea is that the supplements all have their own vibration. They vibrate at a particular frequency. The person has their own vibration, and you know, in the same way that, say, a mobile phone has an electromagnetic frequency around it, so do we. We all have our own electromagnetic frequency around us, and that can pick up the frequency of whatever the remedy is. So you just muscle test to see, do the two, are they in harmony together?
It does, it interferes with everything. You know, because sometimes I forget, because I'm so used to the pain now, that sometimes like I think, you know, it's like as if it's on fire inside. That's a really good way to describe it.
Each essential oil has properties. So you may have one that is particularly good for relaxing a person, another that is particularly good for easing muscle aches and pains, and one that may be good for the skin, digestive system. But they all have lots, that's just their particular one, but they all have lots of properties in them. So by mixing the three together in a base oil, we massage them onto the skin. We do a particular aromatherapy massage, which is very, very relaxing. But the actual oils do all the work inside. So then what we would do at the end of the massage is we would advise the client on how to relax when they go home, maybe do some breathing exercises with them. Again, find out what their home environment is and what they think might be causing them the most anxiety. So we would try and help them to eliminate what's causing their problem.
You know, physiotherapy or deep massage or whatever, you know, I'd rather, because medicines to me only, you know, they only mask what's really going on there unless it's actually sorted, you know, if it is a muscular thing.